We are live, bro. We
Yes, we
are.
are.
Well, I think we are. I'm checking my
Yes,
phone. There we are.
yes, yes, yes,
We
yes.
are live.
Yes.
We set up my
Share,
thing
everybody
there. I
share.
don't know what it is. This thing. That. Oh. Hang on. Technical difficulties right here.
Uh-oh.
Technical. No. Not that kind of technical difficulty. Thank God. It's just my
Your setup.
the lighting. All
Okay.
right. Boom. Mine get the happy face. All right. What's up, everybody? Welcome. Aloha Friday.
I get the happy face right here. You see him?
I see him. I see him. He's really happy.
No, that's an invisible man.
All right. Well, guys, aloha Friday, everybody. Welcome.
Yeah.
Thank you for joining us tonight. Awesome show tonight. We got Dr. Kapono Chong-Hanssen
Yes.
from the West Side Community Clinic, also known as Ho'olalahui.
Yeah.
How you doing, Charlie? How was your day, bro? I know you had a long one.
Well, yep. Just got up early. Uh, did my use this past week and a half. It's a nonstop. But again, somebody had asked me the question now, Uncle, how you feeling? You getting burnt out? Not at all. Because when it comes to the safety of our children, I will do my. Nope. I'm sorry. I'm sorry. There we go. Um, I said, when it comes to the safety of our children, they're all precious to me. And if I'm going to go in and do my best to disinfect a bus or, something of that nature, I'm going to give it my all. And, I thank the people that, when they call, I want to work around their schedule. But unfortunately, their schedule starts early. So I try to be there way before that, right? So that's why I leave the town of Waimea. And if you know the island of Kauai, folks, for those that don't live on Kauai, if you look on the map, you look all the way to your west side, that's Waimea. And I travel all the way to the east side. So I leave about 3:30 in the morning. And all I can say is, you know what I really enjoy? I enjoy the breath of life when I'm coming home. The sunrise is behind me. And it just casts a really nice mural against the mountains of Kauai by Ale. Really nice. And going all the way up to the tunnel of trees and beyond that is just beautiful. It's a really nice shadow being casted. And I just fall in love with this place more and more each day.
Yep. Lucky we live Hawaii. But I'm of course from Kauai biased. I think our island is the prettiest. I love our people. I love our island. I love our state. And again, Charlie, that's why you ask about burnout. Sometimes I feel that way. Sometimes I get up and I'm like, wow, I feel like a one-legged man in a pissing in an ass-kicking contest. That's kind of what it feels like sometimes. Like pissing in the wind. Sorry for those terms, but that's just how I feel.
Yeah.
Sometimes it's just you know under normal conditions when you make a prediction and you're right, you celebrate, you tell people I told you so. And
Hmm.
this time I don't feel good saying I told you so, but I am not at all surprised at what is happening here on Kauai at all. Zero. Terribly frustrated, but definitely not surprised. We knew this was going to happen. There was nothing that was going to be any different here on Kauai when we opted out or opted in to safe travels last year. Why would there be? In fact, the virus got more contagious, so it would be worse. And we're seeing that today. We're
Yes.
seeing the spread of this thing. I did want to see Tiffany is on. Tiffany Kekona or Blackstead is on. I want to thank her for joining us on Wednesday night. Tiffany was very instrumental in getting people off of their ocoles and getting tested,
Yep.
which is what you're seeing today. And those asking, Tiffany is home. She's resting. She is having some respiratory issues, but she did get released. They got her oxygen level back up to 98 at the hospital after an IV. So she is on, people. You can send her your well wishes there in the comments. But we appreciate her stepping up and coming forward on our show and on social media to share with people that may have come in contact with her. So, yes, Charlie, I did want to talk about it. We got Dr. Kapono Chong-Hanssen will be on tonight, and he's going to share with us, talk a little bit about community spread as well as
Vaccination.
vaccines. But Charlie, I know we spoke, and you mentioned Dr. Altenberg, and the reason I bring this up is because while we are being told constantly, and from every single person that Kauai is community spread, and we are, no doubt about it. It is in our community and it is spreading rapidly. But today we had two mainland travel related cases out of the 16 or whatever. And remember now, that case count that we get is only up until the county does their press release. The lab doesn't stop working. The results are still being sent to the people that took the test as we speak. So the number is significantly higher. But Charlie, you mentioned something to me. I would ask that you share that today. As far as community spread, what creates the community spread? And I love Altenberg's analogy.
Well, I did a post, and all I was trying to say in the post was that yes, you have travel related and community spread. But when you put it side to side and it shows that travel related is much smaller in numbers than a community spread, the individuals who's presenting that makes presented in such a way that, you're blaming the tourists. Don't blame the tourists. It's community spread. Well, number one, we are talking about two totally separate things that shouldn't even be in the same arena. Okay. Because if it didn't come in by air or boat, then I'm just wondering if there's somebody planted a seed that went afoul and it became a virus. But so far we haven't found that. We haven't found that. So therefore, it is believed and it's almost certain that it came in from travelers. But we don't focus on that because the numbers are just too small. Everything is community spread. So when I put that post up, Dr. Lee Altenberg responded with an analogy that I thought it was better than mine. And why not when you have an adjunct professor from the University of Hawaii that specializes in, in mathematical theories with regards to things such as spreads. And he writes, if you light a match to a pile of straw, almost all the fire will be from the straw, not the match. But the match is 100% responsible for the fire. Unquarantined, that means that individuals not quarantined, travelers, are the match. And the community spread is the fire in the straw. Don't let anyone tell you that the match isn't the cause just because most of the fire is in the straw.
Charlie, when and I did not see the post, um, but you when you shared it with me, it the light went off, on, I should say. The light went on. Then that I cannot think of a better analogy as it relates to travel related versus community spread. You see, the problem we face is we have a state that is dependent on tourism. And the the Dr. Altenberg didn't say tourism or tourist travel or visitor travel. He said travel, whether you're residents or you're tourists. I don't like when we separate it's the same thing. When you travel, whether you're a resident or a visitor, you are the vehicle. You become the match. So when you shared that with me, and in my mind I could visualize it. That is so spot on. People are trying to blame the straw. all the people that are pushing tourism, trying to blame the straw, because the majority of cases today are from the community and not the traveler. But at the end of the day, the match, the visitor, is the responsible party. So thank you for sharing that, Charlie. That was, I mean, if that doesn't make it clear to people, then nothing will. That's just the way it is. It's just the way it is. You notice though, back in last year, in October when we opened up to safe travels on Kauai last year, the vast majority of the cases were from travelers. Vast majority. And now, this year, it's the community. And we can, Dr. Kapono will explain this, but we have variants now. We didn't have variants back then. And we had people that were being very careful. And now I think because the minimization from our state leadership, or some of them, people are letting their guard down, and you have the variants, and you have more travelers, and you have the safe travel, what I call the unsafe travel program. We are seeing the straw burning, and some are
Well,
blaming the straw, and that is wrong.
well, I would like to say for our viewers tonight, Mel and I had a long talk today. One of the longest we've had in quite a while. But we had a long talk, and again, some may want the bite in what we're going to present tonight, and we're just going to present the facts. That's all. That's all we're going to do tonight. Is present the facts of what we are confronted with, and that if we are confronted with community spread, then we got to start teaching each other how we can combat the community spread. We got to do the best that we can. That's all we want to focus in tonight. And one thing good, we're going to let Dr. Kapono, and he's there with us right now, that he has a vaccination program in Hanalei coming up on Sunday, which I think is very, very exciting. Then we're going to talk about the vaccine. So tonight is, Mel and I, we just said, okay, we've had a lot this week, but again, the bottom line is we have this emerging caseload that we didn't see before. And it's it doesn't look like water is being put on it quickly enough. And we as a community, we have to try to help put out that fire because it is spreading. It is spreading. The danger of it is that because we can't see it. So there is this assumption that just because you're vaccinated, and we've said this a million times, even if we're vaccinated, we still have to be careful because we're seeing cases where fully vaccinated people are getting the virus. And that's why we made that comment long before that based on what is given, then I guess if vaccinated people can get the virus, but not get the symptoms, then I guess we're walking asymptomatic individuals and can we pass it to someone else, even if we didn't know we had it, right? Unless we wear some kind of meter that go bing, 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 you're infected. So that's what tonight is all about. And I think with our esteemed guest, the one and only Dr. Kapono Chong-Hanssen from Ho'olahui Community Clinic out on the west side at the Kauai Veterans Memorial, or a medical center, I say, a clinic. Thank you for joining us, Dr. Kapono, on this Friday, Aloha Friday. Thank you.
Aloha. Thanks for having me on again. Always happy to join you guys.
Thank you.
Well, I apologize for the last minute request, but as Charlie said, considering what's going on right now in Kauai, we wanted someone from Kauai, a doctor, to share a couple of things. Number one is community spread. We are experiencing that, and I'm afraid that it's going to get worse before it gets better. But to discuss exactly, for our viewers in layman's terms, which you do so well, community spread, and then the vaccine and availability. And again, we had I worked with a guy who refused to take the vaccine, just does not want to take it. Today he came up to me and he says, "Hey Mel, I'm seriously thinking about." He watched our show on Wednesday and he said, "I'm seriously thinking about getting the vaccine. What do you think?" I said, "You need to book your appointment now." "Which one?" I said, "The first one you can get." So he's going to book his appointment if he hasn't already. And I don't want to be here trying to push people to get the vaccine, but I think it's important that we have an expert that can share, someone that's on the front line in the trenches, the benefits, especially during a time right now where we have the upticks that doesn't seem to be slowing down. And I told Charlie, can you ask Dr. Kapono? And he said, I'll call him right now. And he called right back and said, Kapono said, okay. So thank you, Kapono, for always being
Thank you.
available for us and for our viewers. And welcome.
Oh, thank you. Well, I echo, what you said, Mel, and I just want to tell the community the way we feel like we fit into this picture, our community health center. And I always try to remind people that, I practice at the Waimea site, but we also have our Kapono clinic site behind Mahilona Hospital. So we kind of try to cover both sides of the island. But we feel like our role is to try to make the vaccine accessible to people that might otherwise have difficulty getting to it, either geographically like Hanalei because of the transportation difficulties, or, they're working and can't find time to fit it in the schedule. So, that's really what we've been asked to do in partnership with a district health office, but also, that's what the community health centers statewide are really trying to do. So the Hanalei vaccination clinic on Sunday is just the latest of what we've been doing. But we went out to all the unsheltered campsites when we heard that they were gonna, the permits were gonna expire. So we hit all them to try to give people the opportunity to have the vaccine. And then we started going out to a lot of the public housing areas, same thing, trying to make it accessible, make it easy. We've mostly been offering the Moderna vaccine. We also do have Johnson & Johnson, but there was that pause in between that we talked about the last time I was on the show with Dr. Berryman. But yeah, we recommend it. The sense that I have, right now is we all sort of feel like stressed. I mean, oh my gosh, we set a record yesterday for cases, and then we set a record today that beat yesterday. And we all had hoped that we had vaccinated enough people that this would not happen when we rejoined safe travels. But it's happened. And so, now we need to bring everyone together again and figure out how we can put out these fires that are, community spread. I like the analogy that you brought up, Mel, which I trace that to Lee Altenberg, who's a expert that's been on your show, and he's been a great resource for me as far as learning about this stuff. But, the fire, he made the point that, if there's fire, most of it is straw, but the match still started it. And don't let anybody tell you that the straw is the problem, but we can also cut down on the straw, and that's what vaccinations do. They cut down on the pool for where the virus can infect and can spread other people. And we're not trying to force anybody. We're not trying to pressure anybody. We're trying to make it easy for people to access it, and they have to make their own decisions. But, we want to be here as a resource to provide information about the vaccinations.
Hey, real quick, Doc, I just want to, because I forgot to do this. Charlie, can you put yours up to just for the double effect? Because right now, people hit that share button.
This is for the people hanging upside down, okay? So it looks right side up to you. Nah, only kidding. There you go.
You see,
Hey, Doc,
we feel so strongly about the information Doc is going to present tonight. Please hit that share button right now. Thank you guys all. Okay, Charlie, sorry about that.
Doc, I was going to ask you with regards to vaccinations, okay? Because it seems the more people that got vaccinated, there seems to be a good number, and I don't know what that number is, but just by the fine detail report that's coming out of the DOH of people being part of an infected cluster and naming how many in the cluster was fully vaccinated, it's becoming more and more evident. What kind of messaging should we be telling people that even though you are vaccinated, I look at it, and the way I tell my friends is that, you're vaccinated, you still can get the virus, but the vaccine is supposed to help minimize the symptoms where you don't have to be hospitalized. That's what it's attempting to do. But yet somehow everybody has this wrong message that, hey, once I'm vaccinated, I'm bulletproof. And that's not the case at all. So what's the message that should be going into the community right now so we can get everybody on board on the same field to combat this community spread?
Yeah, the Pfizer and the Moderna vaccines, generally, the clinical trials were shown to be 94, 95% effective. I've read that some post-trial data shows about 90% effective. So we've seen that of this recent cluster, at least when the county broke it down for us, when there was about 45 or 47 cases, 4 of them had been fully vaccinated, 2 had been partially vaccinated, 40 something had not been vaccinated at all. So it's not completely a surprise that there are going to be a few of them in there. And the people that were vaccinated, they had mild symptoms or no symptoms at all. We don't know enough about whether they could transmit the virus to another person because our tests, some of them, like the PCR test, is so good that it can test such a low level of viral load that the person might not be able to transmit it. And this somewhat relates to the guest you had on Wednesday that I did want to provide a little bit of clarity about. When someone is finishing their isolation period, you can test them for COVID and almost everybody will still be positive. So I just wanted to provide some clarity on that, where, there's not a great benefit of testing until you're negative. You could be positive, from what I read, up to 3 months after you were infected, because it's such a sensitive test. So, those people that were vaccinated they have not had severe symptoms. And Lee Altenberg and Dr. Schwartz, the people that I've kind of met through all of these efforts, they're very cautious about misstating data, which I'm a family medicine doctor, so I try to be the jack of all trades, but I learned from these guys and I don't want to misstate data. But the general, thing that I took away from 40 versus 4 is, okay, so that's about 10% of the total cases were vaccinated. So it's sort of, it's not exactly correct. So I don't want to, mislead people, but it's not inconsistent with what we would expect, that there would be a few people who are vaccinated that still test positive and might be able to catch the disease. But that being said, 90% efficacy as far as preventing the disease is a better weapon than anything else we have right now. And you brought up safe travels. I love Lee Altenberg's session with Hi Pam and his analysis of the Lancet study. One of the dangers of calling this program safe travels and then overstating how efficacious it is that people think that they're safe if that's all that they do. And it's been stated in the public that safe travels prevents 88% of infections, which is not what the study showed. That only pertained to the day of travel. When it comes to, the study analyzed infectious days. So if you look at someone, each individual is having 14 infectious days. And I realize this is confusing because the CDC then sort of cut it down to 10 infectious days. But if you look at it, 14 infectious days, people that travel, and if they spend 14 days in Hawaii, which is what returning residents would be doing, not all visitors, but if they spend 14 days in Hawaii, it's really only 36% effective in catching the disease. So you're comparing a 90% effective vaccine versus a 36% effective, travel protocol. That's a big gap. So that's where I just want people to know that vaccines are really the best weapon that we have right now. And also that it points out the danger, I think, of messaging where we say that the pre-travel test is more effective than it is, because it makes people feel like they did something responsible, they did something to be safe, and therefore they don't need to do anything else to mitigate risk. And I guess I would make a call out that right now we have two tasks: put out the fires that have been started, in our community. So put out these community spread risks, but also travelers, and particularly our returning residents, because we feel more connected to them. We really need to be thinking about, if you travel, even though you tested negative for safe travels, you have to be very cautious about returning to work, sending your kids to school immediately after returning, because you still could be in the incubation period. And I would recommend all of our returning residents consider getting tested. Well, I would say 5 to 7 days, but 3 days after, maybe at least do an extra step before you or your children go back into a setting where you could spread that, spread it to more of the straw. So that's kind of the two things I look at. I think, right now, I would love to see our community, our returning residents in particular, step it up as far as taking some more responsibility, and don't be falsely reassured by the Safe Travels program, and then really reconsider whether you are willing to be vaccinated to cut down on how much straw we have in the community for fires to catch.
Let me ask you something really quickly, and please forgive me with my artiste. But if you can see that right here, you got a pie, right?
Mm-hmm.
And one half of the pie is vaccine. Then the other half comprises of mask, hygiene, and social distancing. In a reality sense, in a sense of realism, how much percent does vaccine play? How much percent does mask play? Because in total, all of this got to work together to make it a fully effective program. So we got vaccines, but now we got removal of masks. When we start pulling away from the percentages that makes a fully effective program, how much does it alter this overall program that we're trying to promote in keeping people safe? Would you know what these kind of percentages represent?
I think it's hard to quantify them. It would be a leap for me to put numbers on there.
Yeah.
But
okay.
I don't think that anybody thinks any of those other things in your pie chart are close to 90% effective. So that's what makes me say that I think the vaccines are our most effective tool in combating this pandemic. So for example, social distancing and your mask, you might forget to put your mask on, or you might social distance, but someone accidentally sneezes right next to you. I mean, what are you going to do? But once the vaccine is in you and you've had the immune reaction, it's there protecting you no matter what those other circumstances are, like hygiene, masking, distance. Those are variables that are that have a lot of elements that are difficult to control. So I see the vaccine as being more reliable in that sense.
Okay.
Hey, Doc, there's a question from Raina. She's saying, how accurate is the time period when a COVID positive person is no longer able to infect others with the virus? I know you just mentioned 14 days. CDC kind of dropped the period to 10, but is that number even known? I mean, I think from what I've read and heard, it differs from person to person, but what's generally, how long does a COVID positive person, how long are they able to infect others?
10 to 14 is pretty standard. I think if you're, 14 is safer than 10. There's been some data about immunocompromised people possibly being able to spread the disease for even longer, maybe 21 days or something along those lines. So there's data out there. I mean, I guess from a completely safety perspective, I would favor the 14 days. It's pretty rare that people can spread it after 14 days. I understand why the CDC made the 10-day recommendation. And I think that partly had to do with whether people are going to be willing to follow the advice to actually quarantine, for 10 versus 14 days. So it's one of those, you got to kind of like make the best decision. What can you do, but purely safety, if it was up to me, I probably would have said 14 days. I think there's a lot of good evidence for 14 days. the Lancet study, I think, kind of highlights that. They chose to stick with 14 days as the sort of risk interval for a typical person.
Well, last year we had many co from South Korea, and they had patients that were found to be infectious up to 30 days in South Korea, and not it wasn't common, but it was happening. I wanted to touch a little bit on, there's a lot of talk about the tourists and all of that, but we know because we've just been going through it, that the more um, vulnerable or dangerous traveler is really the returning resident, because they come home and they go home to a household of loved ones, and then they go to work and mingle with employees, and they're much closer. The interaction is much closer than it is of a tourist that comes here and might see the front desk or stop at a restaurant or go in a store, and that not as much close intimate contact as the local residents. And that is why obviously the spread among the community is so much more rampant. What are your thoughts on 11 days from now, we're gonna be able to travel inter-island without any testing or any quarantine? Is there any concern in your eyes with that change?
You mean with the vaccine
With
for
the
vaccinated?
fully vaccinated people?
Well, okay, if we could effectively verify that people were vaccinated, I have very little issues with it. My main concern is that if we don't have a great way to verify it at this time, or I haven't heard a foolproof way. I do think at the county level they'll probably be able to do it effectively. So kind of getting back to the part before, I guess I see vaccinated travelers as the least of our worries at this time, as long as they really are vaccinated. But that problem is how do you verify it? So I guess I don't see that as being a huge issue. I think right now it's more unvaccinated people, and then of course our children, which is just such a tough situation to be in, where we can't vaccinate them, and we know that they generally have lower risk to get disease, but there are children, and we feel extra protective and anxious about them ever catching the disease. I know we had, our first case of a child passing away in Hawaii. So to get back to your question, I as long as it's, that we have a way to verify it, it doesn't bother me that much as far as the vaccinated people being able to travel. I'm much more worried about the unvaccinated people who think that they have adequately protected our community by only following safe travels. And I think that's much more dangerous, because in theory, that's a 36% efficacy versus a 90% efficacy.
Got it.
We had a question from one of our viewers, and it's how do you feel about people who are vaccinated testing positive and not having to quarantine and returning back to work?
Okay, I don't think that vaccinated people who test positive are allowed to go back to work. I think that they're isolated in the same way as another positive case. But fully vaccinated close contacts of positive cases are allowed to go back to work without quarantining. How do I feel about it? I guess mildly uneasy. I like I've said before, I think it's pretty low risk. It depends on what occupation you're going into. So for me, in a healthcare setting where I'm concerned that we could expose other, our patients to the risk, I prefer to test like our employees, even if they've been fully vaccinated, to test them as well before letting them come back to work.
Perfect. So I guess why I'm having a hard time really struggling with vaccination. I'm fully vaccinated, but the point that you said about the duration period that you can still test positive because the PCR test is so sensitive, but you may not be viral enough to shed the virus, right? But a lay person like us, we don't know what that range represents, because all we know is you test positive. That's all we get. You test positive, and positive, ooh, it's the boogeyman word, right? It doesn't say, well, you can test positive, but you're not contagious. I mean, how many people can you convince of that? I think that's part of the problem that's circulating in the community, that they hear the word positive, right? It's almost like saying you got cancer. Well, they got, through research, they got treatments that can, extend people's lives now, even if you got cancer. But some people say, you hear the C word, they kind of just break down. And unfortunately, I'm one of those that if I hear you say positive, even though you're not contagious, I say, wait a minute, I don't believe that BS at all. But that's just me. I'm not talking on the science end because I'm not a doctor. How do we get a message out to say, hey, this is the reason why a person can test positive but not be contagious? And how do you convince those who got it stuck in their head positive is bad?
Well, I guess beyond explaining that these are logarithmic functions, so the difference between negative and positive can be hundreds of thousands of copies or millions of copies of this virus. So that's the best I can sort of try to explain to people. I guess I would prefer to shift the focus, because I don't really think that people who are concerned that they might still be positive and might still be infectious and want to take precautions, to me, they're not the problem. I mean, it could be problematic for their own lives, that trying to go back to work, or how they feel about, what they feel free to do. The bigger problem is, to me, is the people that test negative, like a pre-travel test, and don't understand that doesn't mean that they're not infected. That's the bigger picture to me. And even in this contact tracing, I know that you had your guest on Wednesday, and it was really enlightening to hear kind of from just a normal person. How do you experience this situation? So I know we kind of talked about the contact tracer identified only a few, very high risk individuals who would have contracted the disease. But the way we experience it as primary care providers is we often hear this other kind of stuff that's around it. Well, they weren't really close contacts, but they spent some time here, or maybe it was a couple of days before, and the contact tracing protocol is not, we all know it's not 100%. It's not meant to be that way. It's meant to be effective in lowering the risk as much as possible, but also to be doable, so you're not kind of like obsessing about one case when there's another one happening. You got to put out the fires everywhere. But those people, lots of times, they want to be tested right away. Oh, I think I was around them yesterday. And you're kind of like, I end up saying, well, I mean, we can test you now, but that means very little. It's better to wait 3, 5, 7. I tend to favor a 5 to 7 day range as far as, when you want to be tested. If you have no symptoms and you're just trying to make sure that things are safe, because you might have had a passing exposure that does not meet the clear close contact definition. So I think that's the more important thing to get across the community, that you can test negative, but if you tested too early, you could still develop the disease. You could still become infectious later and spread it to other people.
Okay. Thank you.
I remember when I had my exposure to a first level contact of a positive person, my doctor asked me to wait 4 to 7 days before I take the test from the date of original contact, of which I did, and I was lucky enough to be a negative. So I think you're right, Doc. A lot of people, they're freaking out and they're getting in line to take tests, and the period hasn't even passed yet. So I cannot agree with you more. Kind of want to talk a little bit about, we're seeing a lot more kids getting tested positive now here on Kauai. Is that because more kids are being tested, or could it be related to maybe the variant that is apparently targeting or affecting more younger people, or do we even know?
I think it partly has to do with the vaccination and that straw metaphor, that we've cut out the adult straw in adult population, we can vaccinate all of them. So where's their straw left? Well, the people that the adults that chose not to be vaccinated, and our children who are not eligible yet. So I think that's part of it. It's also that we send our kids back to in-person school for fourth quarter. But we did hear that there hasn't been any transmission in the schools. There's been cases associated with the schools, but from what we can tell so far, there hasn't been like a staff member who transmitted it to a child in the school, or a child who transmitted it to another child in the school. It looks more like it was transmitted from household members to the children. The children happened to go to school, and then the fire did not spread from there. And we all hope that will, continue to be the case. I do think it was the right decision to try to get our kids back to school. For me, that should have been our number one priority over all of this time. But I have to admit, it made me feel uneasy that we were going to send our kids back to school and opt into safe travels around the same time. And, we've seen on the other islands that they have had clusters in educational settings.
I got two questions from two different individuals, but kind of hit you at one time with this. The first one is, and I know the jury is still out on it, but with regarding fully vaccinated people, how long do you think before they'll come out with a booster? Like how long does the 2-shot vaccine or the 1-shot vaccine last before someone needs to take a booster?
I've heard people talk about the fall, maybe doing a booster.
Okay.
Prior to that, I had heard epidemiologists talk about coronavirus, that they thought maybe every 2 years or so we might need a booster. I think at this point we're lucky. Some people call the Pfizer and the Moderna vaccines the Ferrari and the Lamborghinis of the vaccine world when you compare to what the rest of the world has access to. So I think we're lucky in the sense that we have a lot of availability. Right now the vaccine availability is not really the issue anymore for most of the United States. It's people not, wanting to access it or maybe not having it as easily accessible. So I guess I could see the United States, because we know that flu season and other respiratory infections tend to, bump up in the fall when people are going into the winter season and spending more time indoors. So I could see that happening, where the boosters is maybe going to be recommended in the fall around the same time that we tend to vaccinate people for influenza. But beyond that, I don't have a great understanding of how people came to that conclusion or anything else along those lines. But I think it's probably more like, hey, we now have plenty of supply. We've invested in these processes, so why don't we try to protect people some more?
And the last question is from another viewer. If a person was in contact with someone who tested positive, so let me say it again. If a person was in contact with someone who tested positive, should that person who has taken both vaccination and does not exhibit any symptoms be concerned? So I guess what the viewer is saying is, if the vaccinated person came in contact with someone who is positive, should that vaccinated person be concerned? I guess
Sure.
That's what.
Yeah. I mean, you have a 1 in, sort of a 1 in 10 chance that you could still contract it. So I would say a person like that, if you get a sniffle, if your food don't taste too good, like stuff like that, you should, pump the brakes, get tested, don't go to work, don't do social gatherings, So I think it's still a time to be cautious, even though you don't technically have to quarantine. It's a time to be cautious, but you have to think about what are you doing? Like I said, with my staff, people that are going to a healthcare setting, you should be on guard, because you might have been exposed and you might be able to spread it to other people. Same thing, I'm fully vaccinated. I need to travel to Oahu on Sunday, but for 10 days after, I'm going to be on guard and concerned whether I feel anything and whether I could be bringing something back and be one of those 1 in 10.
Hey, Mel, you know, this is so enlightening. And I told you before, I'm going to say something really crazy, but here it goes. Given up until this point, which is half an hour into the show with our esteemed guest, there is so much on the table to consider along with being vaccinated. I mean, there's a lot of things going on because it still sounds like we can be vaccinated, but there's still some safeguards we have to take. So I definitely think that we got to get some kind of behavior modification so we can do it right. Because as long as you get the attitude, hey, I'm bulletproof, I think that's what kind of kills it for both vaccinated and unvaccinated people, especially once they say, yeah, I feel perfectly fine. No, nothing gonna happen to me. And bingo. And then they wonder, gee, how did I get it? Not to criticize them, but it's just, that's the number one question. How did I, and they spend countless sleepless nights thinking, at what point did I come in contact with somebody that I could have caught it and I didn't see that person sniffling or coughing, but could that person have been infected and gave it to me? And this thing goes around and around and around. These kind of things, I really think it's kind of really not good anyway.
Well, I hope I don't feed into, I hear people say, well, I don't want to get the vaccine because I heard some other people who got the vaccines still got infected. And I hope I'm not feeding into that. That's not the message that I'm trying to say. I'm just saying, in the setting that we are in right now, where we've had, I guess if you want to minimize it, an uptick or a mini surge in cases, I just want to be completely honest about the safest way to think about this, that you're not bulletproof. You got a bulletproof vest, but if you're running into a firefight, you should keep your head down, because the vest is not going to protect you from that part, so there's just, you still have to think about, what the specific situation is that you're in. So, did you have a risk because you're exposed to somebody that was a contact? Do you have a risk because you traveled to a more, well, almost everywhere in the world is more, has more infection than we do, but did you travel to somewhere else and are you coming back? Well, you should be, thinking more about whether something might, whether you might be one of those rare cases, and depending on what your activity is, you should think about it. It's not a good thing to be, let's say, go to Maui, come back and go to your baby luau. I mean, it's just not great timing. Even if you are vaccinated, we still should try to take those measures until we really, really are out of this, because Kauai right now is at a really critical time. We've invested so much, and I think we all feel like this is just weighing us down. We put so much in and we thought that we were almost in the clear, and then now we get this. I feel like it's just sort of like a kick in the groin, I guess, but we can't let our guard down, and I want people to think about that. We're very close, but we need to put in some more effort to make sure that we're not letting this get out of control or harm anybody before we really hit the finish line where we think herd immunity will be. But this relates to the child vaccines too. It's difficult to reach herd immunity when that big chunk of your population of children can't be vaccinated. So, and it's sounding like maybe Pfizer will be available for 12 and above relatively soon, but I know Dr. Fauci mentioned probably the rest of children not till 2022. So, we might not be in that, okay, we can be completely careless for quite a while.
I think we go back to basics, back to how it all began, where we assume that everyone has the virus, assume that you have the virus when you come in contact with people. And if you treat everyone as if they had the virus and you protect yourself, even if you got the vaccine, then you'll be fine. I think that's the message, that with the vaccine and this uptick in cases, the surge that we're currently going through is made it very clear that people that were vaccinated are doing extremely well versus those that aren't. vaccinated. I mean, I think that's what the numbers are showing right now. It goes right into that 90 percentile figure that you gave earlier on tonight. And I think people got to recognize that you are much more protected if you're vaccinated. But it doesn't mean that you go out and do whatever you want and forget about the basics, about the mask and the hygiene and the social distancing and avoid gatherings. That's all part of the total program. And I think part of the problem is that some of the messaging coming out of the state is kind of minimizing the virus and basically, I think in some cases, have people believing that if you get vaccinated, then you're immune. And I've heard that many times. You're immune. Well, like you said, there's a 10% chance that you may not be. And that number has kind of proven itself with Kauai's number so far, and it's still relatively new in the surge. So we got, we'll have more data as the days go by. But people got to understand that cannot let your guard down, even if you had the vaccine. You just
Yeah, I
cannot.
think sorry, Mel.
No, no.
We talked about the CDC recommendations too, that are to me, the timing of it is sort of like the, inability to effectively confirm vaccinations. I understand the science behind that advice, but it just throws this sort of confusion into the whole mix about, what is appropriate behavior and what we should expect out of people. So I think it's good to make the point about, the vaccines are not 100% effective, but they are very effective, and they still are our best weapon. So I don't want people to be hesitant because of what we're talking about. We're talking about how can we go the extra mile to get our community spread under control. And I agree with you guys, about sometimes it feels like there must be such a desire to encourage more people to get vaccinated that we're saying some confusing things to the public, about what is okay and what's not. So we do have to keep that in check, but I think it's met with good intentions, and I think the good intentions are to try to convince as many as people as possible to get vaccinated, because we're finding out that that's the challenge for the United States, and I think a little bit less so for Hawaii, but that's the challenge for us, to get people to voluntarily, agree to get the vaccine. In some other countries, I think they would be a lot more forceful about it, as far as making people get it done. But, that's the way that we operate, and I think it's the right way to operate. I don't want to force people to get the vaccine, but I would love to convince all of them to understand, well, maybe not all, but most, to understand the benefits versus the risks, compare that with the risks of COVID, and realize that this is a powerful tool that we have, and it's not only for you, but for our community.
Hey, Doc, have you seen any reports? Because, I see this individual, I'm just going to read the question out, and it's, I haven't seen anything, but maybe you've heard about why maybe there might be some vaccine hesitancy because with women, it runs the risk of sterilization, or women having miscarriages and bad bleeding or adverse effects. Have you heard anything along those lines with regards to vaccines?
I heard that early on when I was offering the vaccine to my staff. I read about it, and it sounds pretty bogus. I think it was a theoretical risk related to some of the components of the vaccine. All the data I can see is really showing that vaccination during pregnancy looks like it's safe, might be beneficial for the mother and the baby. CDC put out some guidance about that too. And I think the only confusing part about it was sort of whether it's better to wait till the third trimester or better to just kind of like do it as soon as possible. So I wouldn't worry about that risk. We all know that Johnson & Johnson, part, which particularly relates to women's health, because most of the females, most of the case, or all the cases of that rare clotting disorder were females of reproductive age. And so, we're back to offering the Johnson & Johnson vaccine, but at least the way that we modified our vaccinations, we're no longer going to operate clinics when only the Johnson & Johnson vaccine is available. So you have the choice between the Moderna and the Johnson & Johnson vaccine, and we leave it up to you. And I know the way I ended up writing our consent sheet, I felt like it was important to at least point out to women in that age group to think about, maybe the Moderna vaccine might be a better choice for you, because we're lucky we have the choice of 2 different vaccines.
Okay, thank you.
So Doc, before I just want to say thank you before, and there is a question attached, but you with how you spoke about the vaccine tonight, you gave the medical benefit, you gave the benefits very openly, stating the efficacy, and that is the messaging I think that will get people to think about getting a vaccine. What I'm hearing from the federal government and even our state government is that they're dangling a carrot, right? And they're using incentives like, if you get the vaccine, you'll be able to travel without getting tested. If you take the vaccine, you'll be able to go outside without wearing a mask. If you take the vaccine, you'll be able to attend gatherings again without masks. And versus the fact that the vaccine is going to possibly save your life. It's going to prevent you from getting sick, as you have stated tonight. And I just wanted to say thank you for just being real, because I think that's the message people got to hear. We shouldn't tell people go get a vaccine so you can travel. That's not why you should get a vaccine. You should get a vaccine so you don't get in the hospital or die. That's the.
I would add, and so you don't catch it and spread it to someone else, and accidentally hurt them. So yeah, I get that feeling too. It feels dishonest or not dishonest. It just feels off, like it shouldn't be that way. I mean, another thing that I saw when I looked at the new fact sheet for Johnson & Johnson vaccine is there's some sort of strange ways that they state about whether there are alternative vaccines available. So some of this gets into like this legalese sort of like mumbo jumbo that is to me is misleading and confusing. And that's part of why, we try to get messages like this out and just be honest and speak in a way that I think most people could understand. Because it bothers me too, to hear those things or sometimes read things. And I think, the average person is going to read this and they're going to think, what does that even mean? And that doesn't sound honest the way that you read it. And then on top of that, we have a lot of patients who English isn't their first language. Well, good luck understanding that statement, So I hear you, and that's why we're here. I think you were going to lead into a question, but I did just want to mention that the big message I wanted to get out tonight too, related to our Hanalei vaccinations is that we want to make it accessible. And so if there are people that feel like they want the vaccine, but it hasn't been delivered to them or communicated to them in a way that is acceptable for them, that's the need that we want to meet. And I'm open to all kind of ideas. I usually look back at the comments after the show to read. And so, people call me, they usually if they tell me, hey, we think that it would be effective to do something here, then we do it, and that's what we're trying to do. So that's the big message I'd like to get out tonight is that's the need that we want to meet. If there are people that want the vaccine, but it's just because logistics haven't worked out for you to get it, we want to figure out how to make sure you can get it.
Perfect.
That's like so bizarre, because that was my question. That was going to be my question, Doc, and I'm thinking about my friend, the guy that approached me today and has decided to take the vaccine. I heard you say earlier that your clinic is offering Johnson & Johnson. He wants to take the Johnson & Johnson. Again, I'm not here to promote one over the other, but my question was this: if someone out there tonight watching, or tomorrow when they actually watch this, if someone wanted to get a vaccine, I know you can go online and go make a reservation, but if someone wanted the Johnson & Johnson, they could get it through your clinic? Is your clinic open? And the Kauai clinic, are they offering that as well? I guess the question is, what can your clinics offer our Kauai residents as far as the vaccine? and a number or website they can get to.
Right. So Johnson & Johnson, I read on the website today, the county website, I believe it's also offered at Costco. So Costco, and then I believe our clinics are the only ones currently offering Johnson & Johnson.
I'm sorry, Costco and who?
And our clinics.
And you, okay.
Yeah.
Okay.
And so we are opening our Saturday morning vaccination clinics to the public starting March 8th. The county, I talked to Sarah today, Sarah Blaine, about updating information I think they're going to be putting on the site. So for now, we have a phone number to call, which is 938-0938. For people who are interested in that are not our current patients and want to get either the Moderna or the Johnson & Johnson vaccine. And we're currently planning to do that on Saturday mornings.
What's the number again? I'm sorry.
938-0938. And I want to preface that with, this, when we heard that the district health office was not going to be doing the convention hall vaccinations beyond April, we kind of were like, oh, okay, now we need to try to absorb some of this demand. Even though the demand was waning, we need to try to absorb it. So it's a work in progress. I mean, I don't really know how much numbers to expect. We chose it's a cell phone number, so that we could pass it to whoever isn't busy with other things to try to keep on top of, the voicemails. So we're hoping people will call and leave their name, their contact information, their date of birth, and then whether they prefer the Johnson & Johnson or the Moderna vaccine. And if we get a lot of demand, then we might have to come up with other alternatives as far as how we're going to meet the demand.
Okay. Hey, Doc, a question arose from a viewer. This pertains to the approval process from FDA. Are you familiar with that and how it works? Because right now, the vaccines are under emergency use because this is a pandemic. So it's like EUA. When does the FDA roll over into a fully approved status, or how does that work?
I'm gonna have to tap out on that one. I'm not familiar enough with that process to answer that question.
Okay, no, fair enough, good.
So just to piggyback on that number, so that's our plan for the public part. I don't know if it's worth it to go through all the different sites that we're planning to do, but May 8th, we're also planning to go to the Anahola Clubhouse in the afternoon. I think we're planning 1 to 2:30 over there. We have our Hanalei site on May 2nd. We have second doses at several of the different public housing sites on Saturdays coming up too. And I know I said this before, but I just, we're open to ideas. So communicate with us if you think that there's people in need that we can reach by moving our mobile vaccinations. And we've partnered with Malama Pono as well. I was inclined to mention these nurses that are really carrying the load here. They're just doing a great job for us, but I think they don't really want attention. So I'm going to not mention their names in particular, but I do want to acknowledge that it's not like I'm out there doing it myself. We have the teams of really dedicated people that are willing to go out there and sacrifice their weekends to do these vaccination clinics. And before I forget, I don't mean to be dramatic. I know I've been a little bit dramatic on other times about threats, but we got an email today warning from the Coast Guard that there were reports of anti-vaxxers possibly planning violent protests tomorrow. Not on Kauai, I think statewide. But I hope that's not the case, for our vaccination clinic on Sunday. And if people are thinking along those lines, I just want to remind them we're not forcing this on people. We're pretty similar to all of you. That my nurses have families. They're just trying to do the right thing and make the opportunity available to everyone. So if anybody is thinking along those lines, I mean, just please reconsider. It's ridiculous to me that anyone would think that that's the necessary way to go, even if you are anti-vaccines. It's not like we're forcing it on people.
I'm glad you said that because, everybody has a right to protest. If they do want to do that, you can protest your message, but not when it involves violence. That's no, it's not a right thing. There are some people that freedom of choice, they want to get vaccinated, and there are others that don't. Okay. So we'll just leave it at that. But just don't go, if you're thinking about protesting, just don't go hurting innocent people, the workers, the people who are giving up their time. Just, you can state your message, but that's as far as it should go. Shouldn't go beyond that.
Thank you. You reminded me of one other thing. I wanted to just apologize a little bit to the Hanalei folks that signed up. I think there was some confusion today about that they hadn't heard back from the Department of Health. And this is just kind of how these things go. When we do sort of a partnership, we don't exactly know how the processes go. And I think they were expecting to hear back from the Department of Health. I believe we called everyone today that expressed those concerns. But if you signed up, Sunday is on, as far as I know, unless some, ridiculous threat shuts us down, Sunday is going to be. So if you signed up, we're planning to accommodate you. I think people know this, but Moderna vaccine comes in vials of 10, Johnson & Johnson comes in vials of 5. We're going to try to bring some extra if there's some extra interest of people that didn't sign up, but it's not like we can just run back and go get more right away. So you can still sign up tomorrow online on the there's a survey monkey link. It's on my Facebook page. I believe it's on the county site as well. But that might be something that we should promote for Hanalei on Sunday. You can still sign up tomorrow. We just need to know how much to bring.
Wow. I guess I'm kind of surprised to hear about that threat, but okay, we'll deal with that. Again, guys, everyone has a right to protest or whatever. Do not take away the opportunity and the right of those that do want to get the vaccine. Wow, that kind of threw me for a loop. I did want to say, and Sarah Blaine is on. Thank you, Sarah. I saw your response. There was some question. Oh, thanks. Misty just posted the link for the sign up in our comments. So go check for that link. Sarah, there were questions about people that had the first shot and from the convention hall. The convention hall will be open for those that need the second shot, so you don't have to worry. All of you that got the first shot at the convention hall will be given your second shot at the convention hall. And Sarah is saying the survey link is also available on the county Facebook page and the Wainiha Hanalei page for Sunday's vaccine clinic. So that's a great opportunity, people, for those of you on the North Shore. And I know there's a bunch of you on tonight from the North Shore. Please go ahead and take advantage of that opportunity. You can find the link on Dr. Kapono's Facebook page. You can find it in our comments. You can find it on the county Facebook page or at the Wainiha Hanalei page, and you can sign up and go get your vaccine.
And for those people, if you happen to miss your second dose of Moderna and the convention hall is done, we can administer Moderna as well, second doses if needed. So same number.
I'm going to put this up one more time, guys. Take a screenshot if you have to. The 938-0938, that is for the community health clinic. If you want to, even if you're not a patient, an existing patient, and you need some assistance, if you go to the kauai.gov/vaccine, there's all the information that you need and information on the link to register for your vaccine. Guys, now is the time to take action if you want to help curb this surge that we're getting right now, and that's one thing that we all can do. And I'm just encouraging everyone to at least consider it. Doc, any closing comments, man, before we shove off? You probably got a busy weekend this weekend.
Well, yeah, it was. I mean, it was the eventful day trying to get everything in line, for Hanalei. I'm actually going to go to Oahu and film a PSA with some other Native Hawaiian doctors, just trying to get the word out about vaccinations and encourage more people to get vaccinated. I think I said most of what I wanted to say. I do just really want to try to make sure that we're moving forward together like we have been in the past. I know that there were some ruffled feathers after some things that, were discussed on the show on Wednesday. And I think that people all had the right intentions, and I think there were just some misunderstandings. So that's my big thing. We've succeeded throughout all of this by taking care of each other. I've said it before, but it's malama ke kahi, and we have to keep doing that same thing. Just look at the bigger picture. We're close to the what we hope is the finish line, and we've had this little setback. I know we're all tired, but it's time to buckle down again as far as our behaviors. And like you guys have been saying this whole time, we have this new tool now, the vaccinations, that are very effective. It's our goal to make them accessible to everyone. So contact us if that's a need that we can meet for you. We're open to all ideas, and we want to be flexible.
Thank you, Doc. Thank you, Doc. Charles.
Well, first, I'd like to say thank you very much, Doc, for coming on tonight. Appreciate it. Appreciate your thoughts. Appreciate the assistance in understanding. To one of our viewers out there who's continually asking about, what about the FDA not approving vaccines? The doctor said that it's not in his realm, so he can't comment on it, and he doesn't want to put out any statement that might be construed as false. So we're going to try to find that information for that viewer. I would like to say that for the most part, we all have choices. If you elect not to get vaccinated, all we ask is just be safe, because we have seen what happens if something slips up when you're not vaccinated. That's all we're saying. So just be safe, okay? If you're not vaccinated, use your mask and distance, and try not to get, just treat everything as if, you might get it from somebody. I mean, you got to live your life. I understand that. But what we talked about tonight was one measure that can get us back to that sense of getting back our lives, and that's through the vaccine. And but again, I respect the right of those who don't want to get the vaccine and who's on the fence about the way the vaccine is, and maybe you're one of those that need more information. I get it. All I ask is, in the meantime, just be as safe as possible. Be as safe as possible. Thank you, Mel.
Thank you, Charles. Thanks, Doc, for another awesome hour of information and knowledge. We appreciate you so much. I know you mentioned Wednesday's show. I did want to say that, if we had offended or ruffled any feathers, we apologize. I personally apologize. We have been on this journey for 14 months or so, Charlie and I, and all of you, and many of our guests. And it's never our intention to offend anyone. And sometimes my passion overtakes the brain, and I may say something, but I got to tell you, this show is not it is not scripted. It's not edited. We go with the information that we get, and we go with it. I did want to take this opportunity to thank our public health people, all of the people, Doc, you and all of your teams, our mayor and all of his team, everyone that has been on this journey for 14 months or so, that works so hard every day and every night to keep our island safe. And I honestly, from the bottom of my heart, want to thank all of them. And the last thing that Charlie or myself would want to do is upset or offend anyone. But we are not going to stop presenting fact and truth and data to the public. And but those heroes that have been constantly working on a day-to-day basis, and we have an opportunity to help them by helping ourselves. And so all we're trying to do is encourage people to do that. So I want to thank everyone for your patience and your understanding. I just want to say that we try to inform and educate, and that's what we're going to do. And it is never, I know Charlie feels the same way, it's never our intention to upset, piss off, hurt, harm, or any of that to anybody. And I hope you guys understand and trust that that is truly the case. So, with that, Doc, you stay safe this weekend. Thank you for doing your work that you do. I'm Charlie. I'm taking a ride out to Hanalei on Sunday. I think I'm gonna hang out and.
No. I've been getting up early, going from Waimea to Kauai, past that Kilauea, Hanalei today. Went out to Hanalei today. I thank the motoring public for moving on the side, seeing me weave all over the road because I was really tired. No, I'm only kidding. I just want to thank the gracious people out there at in Hanalei for receiving me today. And I do want to say, Mel, and I don't know how you feel about this, but you know, wearing a mask, I'll get somebody come by and say, Uncle Charlie, I apologize because I just don't know who you are. I see you on Facebook, but I haven't seen you in person, and I apologize. But I'm glad you said hello, and hopefully one day when the mask comes off, we can say hello, aloha in the proper way, and hold me to that because definitely I want to get to know you as well.
All right, you guys. You guys have a super duper spectacular weekend. Stay safe, everybody. Again, I'm gonna put this up for 10 seconds. Screenshot it, take a picture, write it down, do what you gotta do. If you have questions, no call for for Talkstar with Dr. Kapono. He does not have the cell phone. Somebody else has the cell phone. So if you think you're gonna get Dr. Kapono, it ain't gonna happen. This is for serious people that want to get serious info. And of course, guys, our Kauai.gov website, you get the COVID-19 or the vaccine pages, lots of information. So with that, guys, we're gonna say aloha. We love you guys. Take care, stay safe. We will see you guys on Monday night.
Yeah.
Aloha.
Aloha.